Hello, this is Marianne Pedraza with the University of Arizona Global Campus. Today I will be speaking on mindfulness interventions for female veterans living with chronic pain. Mindfulness-based training interventions are a good alternative for a non-pharmaceutical treatment for pain management. A study by Oakvat et al. Assessed mindfulness trainings for women veterans with chronic pain, and it was a retrospective study. It was also a health behavior pilot study looking into the management of chronic pain without medication. In this proposed study, the research question asked, does mindfulness-based training decrease pain severity among female veterans in the San Francisco Bay Area? Chronic pain is described as pain due to factors or a combination of factors including biological, physiological, emotional, and mental factors lasting longer than 3 months. The public health challenge is that it affects 50 million people globally, 600 million in healthcare costs, and there is inequity in healthcare access. Vulnerable populations suffer the burden of living with chronic pain due to inequity in healthcare access. The focus population in this study is female veterans. Female veterans have increased chronic pain in areas of severity, combination of additional conditions from physical, physiological, mental, and emotional factors. Additionally, female veterans are less likely to seek treatment than their male counterparts. The previous mindfulness-based study by Oakvat et al. Is training for women to evaluate the behavior of adapting training without using pharmaceuticals for pain management. This was a pilot study, and it is considered a new approach since it does not use any medications. This study was no active recruitment. Instead, data was taken from the Veteran Association clinical records. Everything was done in adherence to safety and ethical standards with Institutional Review Board approval. The data measurements were taken from reliable and valid tools to ensure data consistency and credibility in the findings to draw effective conclusions. The study's findings were that it successfully answered the research question, that increased exposure to mindfulness-based training reduced pain severity among female veterans. The findings were aligned with other studies, reinforcing that mindfulness training reduces pain severity, and there is no risk to addictive substances. Recommendations for future studies is to include the study sample size, use a control group, and incorporate technology-based platforms such as apps on mobile phones. In conclusion, the mindfulness-based training reduced pain, increased overall physical and mental health. It's a good alternative to medicine-based therapies since there is no risk to any addictive substance. It addresses the disproportionate health burden of female veterans living with chronic pain, and the positive findings can be used as a basis for future studies. Thank you for joining. If you have any questions or comments, please go ahead and leave them below. Thank you.